So these are all folks that we've worked with, that we support through the Climate for Health program, and have done incredible things. And so we wanted, not everyone was able, a few of them are here in person, but not everyone is able to come down. And we really just wanted to feature them with these brief vignettes of them telling their story about how they, as health professionals, engaged in climate action in a meaningful way. And so we have, I'll go through all the names. So we have Lori Byron. You've heard her mentioned already. She is the chair of the Montana Health Professionals for a Healthy Climate. Karen Florini. Hi, Karen. She's here in person with Climate Central, which was the forgotten name of the organization that provides resources and tools aimed at journalists engaged with climate, and we also work with her. Janice Hawkins. Dr. Hawkins is a professor at Old Dominion University, also right here. We have our speakers table. And she's a great educator, and so we'll hear a brief video from her. Reginald Vicks from CrescentCare Community Health Center in New Orleans. Dr. Stefan from the University of Washington, and Seema Wadhwa from Kaiser Permanente. So I'll start with introducing Lori Byron a little bit more. So I think we've talked a lot about the lawsuit in Montana. So this was where youth sued the state of Montana for the right to a healthy environment, for their constitutional right to a healthy environment, because of the regulatory decay or conflict that was making it easier for more and more emissions to ignore climate rules for the emissions, and they won. And so Lori Byron, we already heard from some of the plaintiffs. Now we're going to hear from Lori Byron, who was to help support those youth as providing expert testimonial. Let's go ahead and hear from Lori.
Hi. Hi, I'm Lori Byron. I'm a pediatrician, and I'm the chairperson of the Montana Health Professionals for Healthy Climate. And this June, I had the honor of being an expert witness on the Ricky Held versus the state of Montana case, where 16 youth plaintiffs were suing my state for the right to a clean and healthful environment, which is actually part of our Constitution. And they were suing not for financial compensation, but for a declaration that the state had violated their constitutional rights. And in addition, they asked the court to prohibit the state from subjecting themselves to these unconstitutional laws. This was actually the first climate-related constitutional lawsuit to go to trial in the United States. So I feel like it was really important. It had been planned meticulously for several years by our Children's Trust. And every day the courtroom was packed. Everyone in the courtroom was attentive and supportive of the plaintiffs and the witnesses. There was a different climate-related NGO every day who adopted the day to cheer on the kids as they came into and left the courtroom in the morning and at lunchtime. And the kids' tales were absolutely riveting. We heard from Ranch had suffered from drought, and she had watched livestock die. She had seen the economic impacts to her family. We had one of the kids who had a flood that prevented them from getting access to their house. We had a kid who was devastated by watching the glaciers melt practically in his backyard. We had kids with asthma and just other kids who couldn't get outside because of the smoke that we've had. And we had Indigenous youth that saw the seasons for harvesting medicinal plants and ceremonies being disrupted. And overarching for all of them was a despair and a sadness felt because of climate change. Our Children's Trust alternated the plaintiffs with the experts, and they wove a really compelling tale. They fiercely protected the kids during the trial, and they prepared them really well. The well-paid expert witnesses from the state actually refused to show up, and the state's only real argument or defense was that this issue belonged in the legislature and not in the courtroom. The judge's ruling was about as good as I could have asked for, but I'm not a legal expert. It was a huge climate victory for the climate-concerned people in Montana, and it's been celebrated appropriately over these past couple weeks. And the plaintiffs, of course, are absolutely ecstatic. I was an expert witness largely for the medical impacts to these kids from climate change. And then Lisa Van Sesteren, who's a psychiatrist, also talked about the mental health impacts. All of these kids suffered, of course, from mental health impacts, but a lot of them suffered from medical impacts too, like the kids with asthma, the kids that had some underlying medical conditions that made the wildfire smoke more difficult. Litigation is an important action for the climate concerned. Besides these youth cases, there are cases going across our country and across the world, suits against oil companies and against state and local governments. There are suits being brought by kids, by Indigenous people, by NGOs, and even by a group of seniors in Switzerland. There's a lot of opportunities for healthcare providers and others to be plaintiffs and expert witnesses, and I hope that some of you all get the opportunity too.
Most gloating that
Thank
we
you.
got this big win. It feels really good to celebrate it, to dwell on it, but also just because, it's hard to think of something that feels more formal and more of a barrier than a lawsuit, participating in a lawsuit. And, I try to spend plenty of lawyers in my life. I try to avoid seeing any of them outside of social engagements. And the idea of a constitutional case, again, the testifying on behalf of this is as formal as kind of as a high a barrier of entry that you can imagine. And the health voice mattered. The health voice was impactful there. It helped drive the decisions. It helped these kids to make this win. They won it, but the health voice really helped. And so I bring this up because, not all of you need to go and participate in a constitutional case. Maybe some of you will, I hope so. But you can take these same lessons, that same power of that voice, going to your school board and saying, there is so much money for electric school buses. And every day, I remember walking through rows and rows of diesel fumes every morning, every afternoon. There's no reason for us to continue to do that. It damages kids' health. Coming as a health professional to make that point, again, your voice drives that impact. It can be on children's health. It can be on, again, solar panels in your local facility. So I just want to emphasize this is at the highest level that we can make this kind of action, and you can bring this at your local level as well as keep going and go up to those high levels as well. So next up, we'll have Karen Florini, who is the VP of Strategic Partnerships, something like that. Yeah, sorry, at Climate Central, talking more about some of the incredible tools and resources and existing research to help you make those cases, to help make that case between those local climate impacts that can drive local on the ground action.
Hi, I'm Karen Florini with a quick tour of Climate Central resources that can help you show specifics about how climate change is affecting your community's health and solutions for that. Just a quick word about us. We're a science, research, and communications nonprofit. We're not an advocacy group. We never take positions on particular technologies or policies. We produce science-based materials that are localized for over 250 communities around the country, and it's all free. I'll cover a handful of tools, starting with our Climate Matters program. Every week, the Climate Matters Bulletin covers impacts or solutions with graphics and analysis, usually keyed to something that's going on currently. So, for example, in July, we're talking about heat in any of a variety of ways. Every bulletin is released simultaneously in English and Spanish. And it's not just the weather, but also its consequences, such as air pollution, urban heat islands, disease vectors, and worse allergies. The bulletin has multiple graphics as well as key concepts and more. Increasingly, we're talking about solutions too, including the health benefits of solutions, as well as climate solutions for every state. Speaking of solutions, our weather power tool combines installed wind and solar capacity with yesterday's actual weather and today's and tomorrow's forecast to provide downloadable real-time graphics on renewable energy production throughout the country in various geographic categories, along with context through a variety of equivalencies that users can choose among. All these resources can be found on the Resources tab of our website, which is searchable by keyword and by location. We've also got a health toolkit that pulls together a lot of these materials. Another tool is our Climate Shift Index, which quantifies the fingerprint of climate change on temperature everywhere, every day. It uses a peer-reviewed methodology to show the extent to which today's temperature is attributable to climate change at virtually any location worldwide. Our real-time climate alert system continually keeps an eye on weather conditions throughout the US and sends out personalized alerts pegged to something happening now in your location and providing relevant resources from our other tools. To sign up for real-time climate alerts and climate matters, please go to this form on our website, which this QR code will take you right to. A special note, the real-time climate team is currently doing a pilot project with the Harvard School of Public Health. Alerts go to clinicians serving low-income populations when temperatures are forecast to be high enough to threaten vulnerable groups. To join the pilot project, please email health@climatecentral.org and include your location and the clinic name. We also have a major program on sea level rise with interactive maps that show vulnerability to coastal flooding, both present and future. And our Risk Finder tool provides flood risk data for vulnerable demographic groups and for important structures like medical facilities and the roads that lead to them. Again, here's the QR code for signups. I've got a handout that will be available at the National Forum.
Just add that these resources are
You're
really a
also
powerful
more than
way.
welcome to contact me at any point. Thanks.
Not the end. So yep. So that's for the end of that recording. Yeah. These resources are really great, and that we use these ourselves at Eco America when we're developing these individual state by state presentations to try to make it again low a barrier of entry as possible. Everyone who completes our Climate for Health Ambassador program is sent a set of state-based presentations that are the templates are already done that uses data like this and then including this on localized impacts, the actions you can take, the impacts it's having on people's health already to again make that case as hyper local as we can make it to really draw out the ways that you can start taking actions. I think we're up to 17 states now. We're going to get through all 50, Puerto Rico and DC. And make it as clear as possible for people to draw these impacts out and connect it with actions they can start taking. So next up, we've already heard a few of our speakers talk about the importance of integrating planetary health, climate change impacts into both clinical education and public health education. Many people in this room are working hard at doing that as part of their everyday work. We've worked with Dr. Janice Hawkins at Old Dominion University on using some of our tools to do that, and she talked a little bit about that. Jump in.
Hi, I'm Janice Hawkins, and I am a nurse educator and faculty at Old Dominion University in Norfolk, Virginia, where I teach in the graduate nursing programs, but also work with a colleague in undergraduate nursing programs. And I want to share a story today about how we have integrated the Eco America Climate for Health Ambassador training into our curriculum. I work with a colleague who is the course coordinator for our undergraduate nursing community health program. And in that course, we have always utilized learning activities to help students learn about advocacy and how to address community health issues. And the thing that was missing in that curriculum was content directly related to climate change and health impacts. And so we were looking for some easily plug-inable, readily developed learning activities to help with our students, to help them, one, to talk about climate change as it is, a topic that is of concern for nurses and something that they need to learn about, but also to help them learn to be advocates to help impact health outcomes at a higher level. So what we did for that course is we made the Eco America Ambassador training mandatory for that group of students, and they completed it as part of a learning module. And it was really easy to utilize because it was already there self-made for us, and it had was asynchronous, so our students could do it on their schedule. We had, in our first round, we had about 70 students complete the training, and they could complete it on their own time. And then they submitted for our course, they submitted the certificate of completion. And then we made it optional whether or not they wanted to sign up to be ambassadors. And we were quite delighted with our first opportunity that we ran this program, because several of our students voluntarily signed up to be ambassadors. And then we had some, 4 of them went on to then offer a lecture using the slide deck that they had access to freshman pre-nursing students, where they shared impacts of climate and the actions you can take with about 100 pre-licensure nursing students. And then we had a couple of students that developed a poster and shared their outcomes and their learning activities at the National Student Nurses Association meeting. And so they really got engaged. And we also, just for our own knowledge, we asked for feedback about how they enjoyed this. And students, not only did we have, over 90%, closer to 95% thought it was a great learning activity, but we had some very positive comments. And it was clear that this is content that they're interested in and content that they care about. They were very surprised that it was new content. They thought it was very polished. We added a few learning activities in addition to the Eco-America training so that they could grow from there. For example, they might write a letter to the editor, or they might participate in talking to a Congress member or signing on to a letter or things like that, so that they could have some real experiential learning. We're preparing them for the future nursing workforce so that they would be ready to be advocates, not only as students, but in their whole career, hopefully the next over 40 or 50 years as nurses in the workforce. We've now run this for our second cohort, and again had positive feedback from that cohort. So we'll then be offering this course again in the fall. It'll be our third cohort that will complete that ambassador training, and we recommend it for other
Great.
nurse
We were chatting
educators.
after
Would
that
be happy
recording,
to
me and
talk to
Janice,
anyone
about
how
kind
we've
of
been
one of the
using
things that you hear when you
successfully in
talk
our
with
program.
professors about rolling out new things into the curriculum, especially advocacy oriented. What about administration pushback? What about student pushback? And Janice's experience was that if you just go out and do it, the pushback's a lot less. You just go ahead and do it, and generally people are on board with it. Like really, not asking first is sometimes a great approach to integrating things into curriculum. Not to take anything away from the very important curriculum redesign work, but there are some turnkey things that we can do right away. And so we just want to make that available to people. We're working more and more with different universities, both medical programs, nursing programs, public health programs. Happy to offer kind of a guest lecture capstone if people have done this training on their own time, or kind of a communications workshop on these subjects. That's something that we're more than happy to work with any of our university educators that are in the room online or watching this later on. It's a really exciting way to get this tool out to young people at the start of their career, so they come in with that strong base. So next up is Reginald Vicks from CrescentCare Community Health Center in New Orleans. I think we've talked a fair amount about resilience throughout the day and adaptation. I feel like we made the point that this is not in tension with mitigation and with reducing emissions, that in fact, especially if you care about health equity, it is necessary to prioritize mitigation, resilience and adaptation work. And so I was really excited to have Reginald Vicks talk about the CrescentCare Community Health Center and the Community Lighthouse Project.
Mission is to provide services to create better access for healthcare services, especially primary care and behavioral health services. New Orleans and this region of the country, but New Orleans in particular, has one of the highest frequencies of power outages of any urban center in the country. During a disaster, when the power goes out, it's very difficult and challenging to provide full service to the community. What we are trying to do with the Community Lighthouse Initiative is move our operations for emergency backup generator power to a more solar energy dependent environment, moving away from a diesel backup generator system by virtue of implementing a solar backup generator system. We actually operate our facility 24/7 to optimize our operations, but also reduce our energy consumption, and works for us to support our community's efforts around conservation of energy and reducing our carbon footprint. At our particular location, we have pharmacy, we have food pantry, we have outreach and prevention services for health initiatives. We also provide, a number of specialty services, including infectious disease, pediatrics, and OBGYN. And so that access to service, being a cooling center when it's very hot, being a charging station for when individuals need to charge their devices to stay in touch with their families, that all contributes to how the Community Lighthouse will support the community. We're connected with an organization called Together New Orleans. What we're trying to do is set this up as a network so that whatever our strengths are, then we contribute that to the network. So for example, we have a church in our community that's part of this project, and they serve up about 10,000 meals a week. They also have capacity for individuals who have medical devices that need recharging for those individuals to be able to bring those devices to their location for recharging. Combining our resources with their resources, we can provide a network of resources for the community, for hot meals, for pharmacy services, for medical services, and so on and so forth. So every time we can save money and continue to provide services to the community, it also reduces the healthcare burden on the community and helps us to make sure that individuals stay in care, that they can continue to receive services, which keeps them out of the hospital on the acute care side as well as emergency.
So I think just to underscore the point and the kind of how exciting this project is, that normally you get your power off the grid, maybe you have solar panels, and then you don't need to rely on the grid and you have cheap electric bills. But when power goes out, if you're a community health center, then your refrigerators don't work, you can't access your medical records. Basically, care is cut off. Like in a modern healthcare system, when power is out, you can't deliver healthcare services, and the community suffers. That's when the majority of people die after disasters, is when the healthcare system is down due to power outages. And so this model has solar panels connected to a battery, so that instead of relying on a generator, which are both dirty, extremely expensive, especially for prolonged blackouts. And then often in real disasters, you can't get diesel. There's no way to get diesel. So instead, the solar panels charge that battery, keep it topped off. When power goes out, it draws down from that battery before then diesel is your final backup. And so, or a natural gas generator or a methane generator is your final backup. So having that micro grid tied to the solar network makes these community health centers and their network of other community organizations resiliency hubs. That when there is a climate disaster, that people can come there, not just for their healthcare services that they need. Maybe they need somewhere to store the medicine that needs to be at temperature. Maybe they need to go there just to charge their electronics and tell family, I'm okay, or I need help with grandma next week. Being able to go there and have that hub is a life changer. It's real added resilience to the community. And like Reginald was saying, it also reduces their bills. Like having that solar grid up means that in times of no disaster, your electric bills are way less. Because even at night, now you get to draw off the batteries some if there's no disasters expected. And then during a disaster, you're now not relying on extremely expensive, scarce, and dirty diesel, and then you're also able to provide for the community. So it really is one of these multi-win solutions where you are having these impacts across domains. So I just wanted to share that's a really exciting partnership working with NAC, the National Association of Community Health Centers. They feature the Charge Partnership, which helps to finance these microgrid programs using a lot of the federal money coming out of the IRA, so that we can get much lower rates on the loans, tax deductions, all kinds of goodies to get these community health centers to be able to finance the upfront investments of building out these this extra resilience and climate action. So our next speaker, if you haven't heard us say it today, actually, I feel like no one said it, but that health professionals are the most trusted profession in the country. If you haven't heard it today, you've heard it somewhere else. I say it constantly. It might not always feel like it, but it is true. The surveys keep finding, no matter what we do, no matter what people say, health professionals remain the most trusted profession in the country. And so Stefan Wheat helped to develop the Climate RX program that we've been talking about some, and he's going to share a little bit more about how that program is designed and how it works on the ground so you can hear it from the voice of a practicing physician.
My name is Stefan Wheat, and I'm an assistant professor in the Department of Emergency Medicine at the University of Washington. I first envisioned the Climate RX campaign, recognizing that climate change is a health problem, but also recognizing that even for the people who are steeped in climate change and health knowledge and well versed in this topic, they weren't saying that they were having a lot of conversations with their patients at the point of care, at the bedside. And so I saw that as a problem, because this is a problem we need to be communicating to our patients. ClimateRx is a badge-enabled campaign which enables healthcare providers to connect with their patients around climate change at the bedside. And it was really designed with clinicians and health professionals in mind. We know that you're really busy and you don't always feel like you have the time to have deep conversations about climate change and how it impacts health with your patients. And ClimateRx is designed to be non-interruptive, so you don't need to sit down and have that conversation. All you need to do is lift up the badge and allow your patient to scan that QR code to learn more about how they can help protect their health and their family's health from climate change, and how they can make an impact themselves. We also know that a lot of people who care about this problem don't feel like they're necessarily an expert around climate change and how it impacts their patient's health. That's also not a problem. All you have to do, if you care about this topic, is to wear the badge and let the evidence-based information that we have on our website do that heavy lifting for you. And I think it's also important to recognize that a lot of people feel that uncomfortable introducing this topic in the clinical space. And I think the great thing about ClimateRx is that it normalizes acting on climate at the bedside with your patients, and allows your colleagues to do the same, because they can scan that QR code, go to the website, and register to get their own free badge to do the same with their own patients. I myself have had a number of conversations in my practice with my patients where they see this badge hanging out, this prompt hanging out from my ID badge while I'm working in the emergency department, and they're curious. And I have the opportunity in my own clinical environment to help them, scan that QR code and learn more on their own. And I think, the other thing that I find really powerful about the ClimateRx campaign is that, while it does empower health professionals to take an active role in engaging their patients on climate change and health, there's also this passive component and passive messaging that takes place just by wearing the badge. As a health professional, we know that you're a trusted voice in your community, and just by wearing a badge that communicates that you care about how climate change influences health, you're sending a powerful message to your patients and colleagues. And that's, and so I think really, if you're a nurse or a pharmacist or a social worker, a public health worker, a community health worker, or someone working in a hospital sustainability team, or really anyone who works indirectly or directly with patients, the ClimateRx campaign was
Stefan,
made
yes. So
to
we are
facilitate those
continually
conversations
updating
between
the
you, your
content
patients,
that
and
this
the community.
QR code takes you to, trying to make sure that it's the most up to date. We have a patient facing side, a provider facing side. We want to have resources so that people who want, the providers or health professionals that want to do more on climate and health, can find that easily on that provider facing side. And for the patients, it gives actionable steps they can do to protect their health, their family's health, and start taking more action on climate change. So I've said it before, there are plenty of badges out by that front desk. If you want to distribute to your facility with your colleagues, or know of someone who might want to do that, let me know. Come and chat with me, or send me an email and we can work on that. And I think last but not least for our speakers is Seema Wadhwa, the Executive Director for sustainability at Kaiser Permanente. So it's a very big organization. We're proud to partner with them on rolling out more and more work around climate engagement. We'll hear from Seema.
Executive Director of Environmental Stewardship at Kaiser Permanente. I am so thrilled to be sharing with you a little bit about what we are doing at Kaiser Permanente. As the nation's largest nonprofit integrated health system, Kaiser Permanente believes that where we live, the places we work, and the air we breathe profoundly impacts our health. At Kaiser Permanente, we have been focused on understanding how we can make an impact by reducing our own emissions. Very excited to share that in 2020, Kaiser Permanente achieved carbon neutrality. This is a focus on our Scope 1 and Scope 2 emissions, and part of our Scope 3 emissions as well. This was achieved by making investments in large-scale solar and wind renewable energy. In fact, We are the 8th largest user of solar energy in the country. And at this point, all of our facilities are using electricity from 100% renewable sources. In addition to what we're doing from an energy perspective, we're also very focused on how we can manage our sustainable operations through our supply chain efforts and working with suppliers to really collectively drive change along with peer health systems. We know and understand that the more we can do to reduce our impact, the better opportunity we have to improve the health of the communities we serve. Additionally, we know that making investments upstream in the communities we serve can have a downstream impact on health through a lens of environmental stewardship. We are very focused on building tools and evidence to help drive action focused on climate and environment, and also to really help people understand the important relationship between climate, environment, and health, and really shift the narrative from being one focused on how climate change is impacting polar bears to how climate change really is a key central health issue for you and for your families. We have been so grateful for our partnership with EcoAmerica in helping drive education and provide tools and resources to our clinicians and team members in understanding the basic fundamentals of how climate and environment are changing health and also how they can take action. We have appreciated the important role that clinicians and advocates bring to the table in raising issues and being part of the solution. We realize that we cannot do this alone, and it really takes everybody bringing a variety of different skills to the table to impact change. We look forward to working with you and hope you join us in a journey to create a healthier and more sustainable
I'll just say that it's been
environment
really
for our
rewarding to
communities
work
and
with Kaiser Permanente. They've been such leaders on sustainability, and I think that what I've had so many conversations with Seema about how the voice of the members, of the staff there, the clinicians, the other health professionals, drives so much of the action, and that looking for more and more ways to get them engaged, get them educated, so they can make those demands of the organization, they can push for more, that these organizations, you know, even super big ones like Kaiser Permanente, are responsive to people saying, this is what I care about, this is impacting the health of my patients. And focusing on that health lens, on the existing commitments of the organization, whether it's to health equity or if it already has commitments on environmental stewardship, and bringing more and more climate action is a great way to turn your individual action into that organizational change and drive for more and more action. And so that's something that we're really trying to make sure that our resources support you with and prioritize. So again, all of our resources are here. We are happy to customize these to drive towards those actions.